If you have arthritis, you know how the pain and swelling affects your life every day. Don't let arthritis control your life any longer. The Arthritis and Infusion Center is one of WMVB-TV's leading medical practices. Dr. Crayton and his staff specialize in the diagnosis and treatment of arthritis. This is where you'll find the latest therapies available today. They provide patients with the most up-to-date technology and personalized care in a professional, comfortable setting. See how our experience makes a difference in the lives of our patients.
The services that are offered here at the Arthritis Infusion Center are diverse. We offer bone density scans for osteoporosis. We offer MRI scans for the early detection of rheumatoid arthritis. They're also used to make sure that the therapies that are being given are working to prevent further joint destruction. The biggest part of the Arthritis and Infusion Center is the Infusion Center. The reason why there's so much emphasis on the Infusion Center is because there's so many drugs that have come to market within the past 5 years. These are the drugs that have been found to actually stop further disease progression, and when given early enough can prevent any joint damage. The nature of these chemicals is such that they would be too easily broken down or digested or torn apart with gastric juices. So giving something intravenously or by injection allows that much more of the medication to be available for use. When you take something orally, go through the digestive process, some of it gets broken down in the liver, some of it gets broken down into the kidneys. There's just a smaller part of that medication that's available for actual use in the body.
Over the past 10 years, Dr. Crayton and I have developed a very personal relationship with our patients. They feel like they're more than just a case number or an insurance card. They are actually a person with pain, with quality of life issues, talking to one doctor who understands and compassionately and urgently is seeking for an answer and a cure for their problems. Infusion therapy is directly into the bloodstream. It works better this way to get directly into the bloodstream and working quicker with the brain. And it bypasses any absorption issues with the stomach. We do several different medications where it wouldn't be possible for the patient to take a pill orally. Therefore, infusion therapy is the best benefit. Certain biologic medications have proven and effective track records with bringing a patient back to where they were 15 to 20 years ago, associated with their mobility, their daily functions, and their quality of life. In some instances, it can even improve their energy level throughout the day. So with certain medications that we do infuse in our office, we've had proven results where the patient has said that they feel better than they felt in the past 10 years. Education to a patient about their therapy is very important. It's important for the patient to not only know what drug they are receiving, but the possible risk and benefits. They definitely need to know the associated risk involved and what they're getting into and the length of the therapy. So we spend a lot of time, Dr. Crayton and the nurses, all of the staff, making sure the patient is comfortable with what drug they are receiving, the procedure of putting it into the body, and the outcomes associated with that therapy.
I discovered something was wrong when I got to the point where I couldn't dress myself. And to a person who has his own business and travels all over the world serving clients, it was obviously a serious problem for me. And I was diagnosed with rheumatoid arthritis. And the doctor told me, I have bad news and good news for you. The bad news is you have rheumatoid arthritis. The good news is we can really help you. The various treatment regimens for rheumatoid arthritis have dramatically improved, and you will be able to live a normal life. He gave me a reasonably thorough explanation of what rheumatoid arthritis was, what the physiology of it was, why I was suffering the way I was, and that he was going to be able to help me. He then brought in 3 choices. He said, here's choice number 1, here's what it is, here's how it is administered, here's the pluses and minuses of this particular anodyne, this particular treatment. Here's number 2 and here's number 3. And I chose treatment number 1, which is a drug called Remicade. And Remicade is administered via an infusion process. Infusion basically means you come to his office, you sit in a chair, a lazy boy chair, for about between an hour and a half and 2.5 hours, depending upon the nature, how much you need to receive, and you're connected to a machine, and the machine basically drips this into your veins. It's completely painless. So I've been extremely pleased. I like Dr. Crayton a lot personally, and he's just an extremely nice fellow, very easy to get along with, likes to explain to you what's going on and give you choices.
The most important thing that I do with any new patient is I talk to them. 85% of diagnosis in rheumatology can be made from talking, listening, and asking the right questions. That is more important than any laboratory work. I do what a lot of doctors don't spend the time to do, and that's talk. And it's equally important to be able to listen. But that's where the fruit is in talking, because if you listen to people and you lead them in the right direction, they'll tell you what's wrong with them.
I became patient of Dr. Crayton since June of 2004. That's the year that I moved to Florida from California. When I sat at Dr. Crayton's office, I never forget my first meeting with Dr. Crayton. He reached from his chair and he held my hand. He said, "What would you like me to do for you?" I had never seen a doctor would ask me that question. And because it was not like, okay, I'm going to do this, I'm going to do that, I'm going to do this, and I'm going to do that, you know, and leave me out of the picture. It was, what do you want? So, and I started crying. And I told him that I'm alone. I don't have no family here. My mother, my family, everybody is in California. I'm all by myself here, and I have this disease, and I haven't. And he said, "Don't worry, we take care of it together. And so tell me, what medication are you on? How do you feel about taking this medication?" He wanted to know everything about the medication that I was taking before he could recommend any medication. You know, it was not like he was selling a drug. It was not like he was selling his practice. It was getting to know me. And I know he's one doctor, and to me it's easy to remember Dr. Crayton, and for him it's hard to remember all the patients, but he remembers.
Visit this website to learn more about these solutions or call the Arthritis and Infusion Center today to schedule an appointment.